Hi, my name's Alisha and I work in the Community Respite Service at Southern Cross Care. Our day respite cottages and buddy program provide a service for clients to engage in meaningful activities, whether that might be in a group setting or on a one-on-one basis within the community. These services are not just to client to utilise, but it is also providing their loved ones, our primary caregivers, the opportunity for some quality respite time to themselves. Now, our philosophy in the program is to empower people to live their best life. We do this by encouraging people to keep active and participate in the range of activities with our staff. We believe that doing things with people rather than for them is the key to best outcomes. The people that participate in our programs want to stay living in their own home, and we encourage them to maintain their skills so that they can do this for as long as possible. Most of all, we encourage people to have fun and live in the moment. By all means, this also resonates with our clients' loved ones. Now, caring for someone with a chronic health disease can be physically and emotionally tiring, and at times stressful. For someone who is living with a chronic health disease such as stroke, Parkinson's, or even dementia can already be challenging, as caring for them can become overwhelming at times. You may feel things are going okay for 1 minute, and then more hurdles would present themselves. Being a caregiver can be a long-term responsibility, and throughout the time, it can be quite overwhelming, in particular when your loved one is not getting any better, or if, despite best efforts from everything that you do and try, the condition continues to deteriorate. Now, learning to recognise and being aware of signs of caregivers burnt out is so important that you can take action immediately before things become worse. It is so important that you, as the caregiver, look after yourself, as if you were suddenly become ill, who would then care for your loved ones? Caregiver burnt out and stress can present itself in many ways. The common signs can be that you have increased anxiety and irritability. You have lack of energy, feeling tired or run down. You have difficulty sleeping or having difficulty concentrating. You might find yourself getting frustrated over minor issues or withdrawing from your own needs because you're either too busy or you don't care anymore. And disengaging in things that you once did that gave you satisfaction or joy. Connecting with services and support groups is always helpful to reduce caregiver stress and burnt out. After your initial diagnosis, it is important to start creating connections to establish a good supporting network around you. Part of that challenge for a caregiver can be accepting help from the outside. It is important to have a good relationship with your health professionals and specialists that can support you and the person who you are caring for throughout your journey. Now, establishing a good relationship with your GP is the foundation to your support network. Now, establishing a good relationship with your GP is the foundation to your support network. Speak up to your GP about how you're going and express your concerns if you feel that you are not being heard. Then there are services that can provide support for yourself. Services like Carer SA, Carer Gateway, Dementia Australia, the Hospital Research Foundation Group Parkinson's, Stroke Foundation, or the Cancer Council. All these services that I have mentioned have services within them to provide support for caregivers who wish to seek them. Now, another key service that you can access is respite service. This can be a variation of day, overnight, in-home, or even some residential respite. Taking time for yourself is quite important, as having some respite time can allow you to engage in activities that you haven't done in a while, getting yourself to important medical appointments, do your weekly shopping, or catching up with friends without the worry that your loved ones are at home on their own. The thought of taking respite time can be daunting and at times feeling of guilt. However, if you don't make time to care for yourself, then you're at risk of carer stress and ultimately not being the best version of yourself to care for your loved ones. So my take-home message for our carers is to seek help and support immediately when you're feeling stressed. But very importantly as well, accept the help when it comes to you, as you are just as important as the person you are caring for.